Today we are going to discuss something not a traditional thing, but a part of the medicine which is totally been ignored by all of us. I also never knew about this thing till I got this book. This is a book written by Siddhartha Mukherjee. Anybody heard about Siddhartha Mukherjee? Dr. Siddhartha Mukherjee? He's an oncologist based at UK. He wrote a lot of books on about this, what's happening. He's a good observer. Because the more you observe, the more you think that something is going on, which I have to show to the people, then you will go on writing. Because writing is the only one way by which you can express yourself. Because this type of stages, you don't get much. Fine. If we create a stage also, there are few people only. Fine. So it is not because these things I've been facing since last so many years now. It's now 10 years now. I have been working on these type of things, how to delegate or deliver the knowledge which I have. This is 30 years in this profession. So I thought, whatever knowledge I have, that has to be distributed through something. So I adopted this method. One is that by giving some talk, and another is by writing books. So both of the methods they go together only. One cannot go without the other. So we all are medical practitioners, and somewhere we have certain roles in the society. We have certain things to say. I'll start with this small. This is the book which I am saying. Everybody should read this book. This is small. It looks like a very small book, but if you go through it, it will take another month to understand each and every line. Just like belly and love, every line is important. This book, every line I have read and underlined. Still, there are a lot of things to understand because he has put so many things in such a nutshell. Because you have to refer out to understand more and more. I'll come with a story first. Fine. This is a story of my when I was in 4th year, post-MS, just like Atul. And post-MS, I was in the evening. I told the story to many of the people also. One evening, we got a patient with multiple bullet injury. Fine. And that patient was rushed to the OT. And my boss, Dr. Saxena, whom I respect, I always talk about him. He's a great man. And he told, you take the patient to the OT because there are a lot of people, department is involved, cardiothoracic, neurosurgery, orthopedics, and general surgery. So we all were working together. And I was standing and I was doing a lot of multiple operations in the intestines. And I was cutting off and doing the surgery and something like that. So it was going on. My boss entered after half an hour of the surgery started. He was always with us whenever we used to do surgery, which was complicated. And he was standing there, and in one person, I was trying to dissect something or trying to remove that bullet from a particular site of the posture of the abdomen, and it started oozing out. And within minutes, it started spurting. So I was really nervous because I was just post-MS, and that patient was one of the richest person of that place. They were SROF. They were a lot of VIP patients, we can say, ultra VIP. So I didn't know what to do. I just pressed the building area, and I was waiting. I was thinking what to do. I looked at my boss. Then my boss asked me, what is the bleeding profile of this patient? I was not knowing. I didn't know. Fine. Then he told, then if I also don't know about this, what is the bleeding start of the patient or anything about it, what I will do, let you just watch. Then he immediately washed and he told me, place there. He came after 5 minutes. Not 5 minutes, within 2 minutes he came and started things. And within 5 minutes he did some 1 or 2 stitches and the bleeding stopped. I was relaxed. Fine. At least I was saved. And then he looked at me, then he'll proceed on. And I was thinking that patient was unstable also. Then I looked at my anesthetist and I told him, should I proceed? And he told, okay, you proceed. Then after that, I think another 2.5 hours or 3 hours, I was doing the things, but the things went very smoothly. It's because of that particular incident made my hand to work in a different way. There was no more hodgepodge. Everything was so precise and so nicely. So 2.5 hours, because that day we finished the surgery at 7 o'clock in the morning. Started. It was 12 hours long surgery because everybody were working. So there are multiple perforations, multiple things, suturing, and all the things were going on. That day my boss, when I was coming out, he told me one thing, this particular line which I remember, it's easy to make perfect decisions with perfect informations. And medicines ask you to take perfect decisions with imperfect informations. You agree with me? So this is called art of medicine. So we always think of art and science of medicine. है ना? You agree with me or not? So this is the art. When we take every day, we have to take perfect decisions with imperfect informations. I'll give you one more example. I was treating one of my 16 to 17 years old girl came to us with persistent vomiting. Persistent vomiting means the vomiting was not stopping. Now, because vomiting and pain abdomen comes surgery, the patient was admitted. The girl's father was a physician. Mother was a alternative medicine practitioner, and that to be an established practitioner. They were very close to me, fine. And I admitted the patient and I started treating as usual standard protocol-based treatment we are doing, and there's no improvement. And then I have to take the help of a physician. So I called my physician, Dr. Kakkar was there at that time. He started treating the patient. And another 24 hours gone, there's no improvement in the things. I was frustrated actually. And that to known person and with persistent vomiting, not stopping with all medicine, where is the cause? We're looking for. We didn't find any cause for this. And that was the time I was thinking of referring the patient to outside, because now it was beyond my, now it was going to be 36 hours now. Patient was consistently vomiting and no medicine was working. And that time I was sitting in my room, so that mother of the girl walked into my chamber. She was also very tense, and since she was sitting there, she was started crying. And she told me, yes, sir, this all happened because of that boy who has started ditching her, not stop talking to her. They were, this girl had a relationship. No, not relationship, she had an infatuation with somebody. And that's when, and since last 5 to 7 days, that boy is not picking up the phone. And from that day, he's not eating. And all things started because of her. And suddenly everything changed. Fine. Then I told, if you don't mind, I will try to consult a psychiatrist. Then we consulted a psychiatrist, and immediately within 4 hours, vomiting stopped. See, it was an imperfect information. Right? But we were trying to give a perfect thing, something like to cure the patient, which was not possible. So this is what medicine is. This is very much, we call it, medicine is lawless. There is nothing happens, what do you say, that it will be repeated again and again. So we'll come to that. Right? So this session is all about information, imperfection, and uncertainty. This is all about these three things, and I call it, this is the future of medicine, where we have to see what is the future of medicine. With this, we have to work. For you people, these three things will always be there. We have passed through those stages. When I am 30, after 30 years of my practice, if I see this is 100% correct. And for you people who understand, you will be going through this imperfection and uncertainty throughout your life till you retire or you stop practicing medicine. So you have to be very careful, and you have to understand with this, what can we do? How can we make some law? How can we understand more and more about this subject? Because we are reading, subject we are reading. We are very good at it. You will be a very good physician, somebody will be a very good surgeon. But these things will come. And without knowing about this imperfection and uncertainty, we cannot move forward. So there are some missing part. What we do, the missing parts are what we do with the information which we have. We have numbers. We have a report. We have numbers coming in front of us. Every morning when you open up the file, there are numbers. We play with the numbers. There is a reports, ultrasound, ECG, all the things are there. But now the missing part is what we do with the information, how we interpret them. That is more important. And I call it, when the data is imperfect, uncertain, and incomplete. Tell me a patient in this hospital, now out of 300 patients, which patient has got this thing correct? None of the patients. Still we treat. Still we treat. Yes or no? So now comes the role key with these missing parts. Somewhere we have to find out those missing parts and create a harmony between them. So this is again another story, Mr. Swai. I told you people many times also. This is again a story of that uncertainty. Fine. Suppose a patient, uncertain, what is uncertainty? Suppose a patient like this, a 70 years old man with a 32 bilirubin, this is the leg, and the patient diffused, and patient was about to die, no pulse, no BP, reached to a hospital. What should we do? What should we do? There is already diffused, which is a big tumor, and the patient is going to die. Ideally, we should say, like some other hospital diffused, and you can always say, no, yaar, kuch hoga nahi. But I operated upon this patient with an intuition only. With only an intuition, with only a hope, can I do something for this patient? Fine. The patient who was supposed to not to see the next day morning, That patient lived for 4 years with that big tumor. And he died. He came after 4 years and died with me with a thinking, I'm going to die soon. So this is what is the uncertain. This is where our medicine fails. This is where you have to understand. Medical education has taught us plenty of facts. So facts, what are the facts? The facts are the reports. But nobody teaches us the space that lives between the facts. Like this patient, the patient, should I operate or should I not operate? There are a lot of facts. The facts are written in this chart, report. Agree? We have the facts. But the space between the lot of facts, what is? Nobody tells us. We have to find out what is the little things lying. So every patient is different, every person is different. Here our modern medicine, where we are helping people with those things. So where we stand today, and we have to somewhere look into this space between the facts. Because every day, every time you will be seeing those reports only. Now it is you who have to find out what is the reality behind it. So now we look into the things. Modern medicine में क्या होता है? What we call it? We have a lot of defensive. We have created a lot of defense around us. What are our defenses? In modern medicine, if you see, look into the last 100 years. Now you can say, you know about the history of modern medicine. I'll come to that. Now with the defense, we have what defense we make? Compulsive naming of parts. We have certain big names we have already started putting. Cholecystitis, hepatidinocarditis, disease like cystitis, chemical reaction like glycations. We are all acquainted with these type of terms. You know what? These are the terms we use, always we say, against the largely unknowable sphere of the knowledge. This human body is such a huge knowledge bank, and we have little bit of knowledge. So we have to hide somewhere. Somewhere we hide ourselves with these names and big terms and big procedures and all these things. But most of the times we also do not know what is going to happen. Agree or not agree? We may or may not agree, but you have to understand this. Many times, against this largely unknowable sphere of knowledge, we come up with words and the diagnosis and this model and protocols. Everything comes into the picture to save us. And one is this abundance of evidences disguised as a deeper, more essential issues. These evidence that come as a disguised as a deeper, more essential issues that cover up. So we have evidences, but these evidences, like if you go to the studies, lot of studies which are being done, there we call it 70%, the result is 70%, so it's a good medicine. This procedure helps in 80%, so it's a good medicine, but it still doesn't work in 20%. And we do not know our patient will be coming in 20% or is it 80%. Yes or no? This happens. But we are following certain things because we now are safe with these evidences. If we do it, if something happens, we are safe. But we have to think of those 20% also. It means our patient come into 20%, and many patients come into 20%, where it doesn't work. No drug works, no operation works, nothing works. So somewhere we have to bring the harmonization of clinical wisdom and knowledge. Now there are two things coming into the picture. There are two words, wisdom and knowledge. Is that same thing or different thing? Anybody? Knowledge and wisdom are same thing or different things? Now, if we look into the knowledge and wisdom, these two sides, just see. Knowledge is fixed, wisdom is fluid. Knowledge is fixed. I know somebody teaches us that in this fever you have to give paracetamol. This knowledge, I have a knowledge, fever 102 degrees, responding, and it is fixed. But a wisdom is fluid. Then I have to think, I'm not fixed now. Why this fever has come? What are the things? What can be done more? Can I do something more this then? Is there anything else? So that is not fixed. No more I'm going to give a paracetamol without thinking. A person with a wisdom which is having a different approach than a person with a fixed knowledge. Fine, knowledge is always fixed. And knowledge is certain. You have been told, you have been seen, you have experimented that this is happening like this. This is certain. I know it's going to happen. But wisdom is uncertain. When the wise man or wisdom, the person having wisdom, they don't claim anything. They always say, I don't know, maybe there's something different happening. They go on analyzing the thing in a different way. This is because knowledge is, what we are gaining here is knowledge. And we have to reach to that place called wisdom. We have to, so in due course of time, you cannot reach it like this, but in due course of time, you have to reach to this. You have to go from knowledge to wisdom. Knowledge is perfect. We call it perfect. Fine. We have to do certain way. So this is the perfect way. I tell you perfect suturing. Yes? Yes or no? You have done a perfect work. Yes? This is, once we have knowledge, we do the perfect thing. But wisdom is imperfect. Many of the times you have to go in a different way. This is where wisdom comes. And this is concrete, this is abstract. So the person having wisdom are sometimes considered abnormal also. Yes or no? All the people who have achieved wisdom, they are not knowledgeable people. The knowledge and wisdom doesn't go together. So here we are going, where everything we are, our training gives us knowledge. Fine. But somewhere on the line during the course of our life, we have to reach to that level. Everybody may not be able to reach that, but this should be the trajectory. Fine. You remember this girl? Harmony Granger? Huh? Harry Potter? You know, somebody asked her whether she wishes to learn the magical law to pursue a career in magic. Fine. Then her answer was no. I wish to learn the law to do some good in the world. That is, we have to make a career, because the first question that somebody asks you, then most of the people, I think, whoever has started, when they enter to the medical profession, they have this goal. Even I had. I think when I pursue the medical journey, I want to serve. But during the course of time, something happens and the goal somewhere get distracted. Fine. But exactly, the thing is that these things which you are going to teach, these laws and the things which you are learning, this is going to serve. In some way or other, we are going to serve. This should be our aim, and this should be only thing which we have to, with which we have to spend our whole life. Because everything, remember, only one thing is good with us, everything we do, we are going to do good to this. Intentionally, we never do anything bad to anybody. But there, how much wisdom we have, that matters. Now the question comes, is medicine a science? That is a thing. And how many of you will tell me medicine is a science? How many will tell medicine is not a science? Now there is a controversy. Anybody, now the people who has ever gone through the history of medicine, there is a book written by Thomas Lewis or something like that. It's called Youngest Profession, something like that. In that book, he has written a lot of things how medicine is in 30s. Medicine is not yet 100 years old. No, the modern medicine is not yet 100 years old. All the development, everything happened after 30s, 1930. Yes or no? Who is the William Osler kab ka tha? William Osler is 36, 37. Before that, there are three things I always say used to be the part of the medicine. One is, I think, purgation, persuasion, and another P was there. So they used to do all the sort of arbitrary things. There's nothing, for the first time, William Osler in 1933, he started putting patients in the hospital and started observing. Before that, there was no observation. They're all things going like this. Somebody has told something and it was being done like this. Surgical field, there are certain things we're doing people, but in other where there's nothing. All these things were on assumption basis. In 30s, when William Osler first started his clinical ward, he started observing every patient, even what's the temperature, if the temperature like this, what is the urine output, what is the thing happening, what is his pulse rate, everything he started documenting the things. And there started the first medicine book, no? That what is the book of the medicine? William Osler. That name I'm forgetting. The book was written on the observation only. So modern medicine, what we are today, it is, if you see, modern medicine is not a science. It is an observational science. Why? And we have a lot of technology added in between. In last so many years, technology has been added to us. So technological innovation don't define a science. They merely prove that medicine is scientific. We are scientific people. But modern medicine is not a science. Science को define करने के लिए क्या है? I always tell you, and all these therapeutic interventions are based on the rational perception of pathophysiology. This has come in between this last so many years. 70, we understand the pathophysiology, and this technological intervention has come into the picture, but the human body has not changed. We are the same human body, the diseases are the same, and so we have to understand what is a science and what is a science. For a science to tell, it has to be replicated. Physics is a science. Law of gravity. Fine? this we can explain it. Everywhere you go, the law of gravity will work. Chemistry is a science. H2 plus O will be water. It always will be water. But in medicine, does it happens like this? Does the same patient come with the same company, the same medicine, work the same thing? No. Then how can it become a science? It is an observational science. So we should not be we should never be mistaken scientific as a science. We are scientific people, fine. But modern medicine is not a science. So that you can replicate this thing. The difference you have to understand this. Same operation you do to a person, fine, and the results are different, both of them. One person will move around the second day, the other person will stay. These observations have made me to go into thinking in a lateral way. In 1998, when I came, I was an aggressive practitioner because I came to a hospital where a lot of patients were there. I was the only one surgeon. There were 3 physicians, lot of workload. So I thought this is the way. But I observed one thing, that every patient was behaving differently. Though I was doing the same thing, every patient was behaving differently. So there must be something different, no? So somewhere the patient's pathophysiology, his cellular level, his thought process, his body is responding to the same treatment in a different way. So we are scientific people, but we are not dealing with the science. Remember this. These two difference. This is how it's most important thing I want to highlight today. Whenever somebody calls you a science, medicine is a science, tell them it's an observational science, and you will be saved. Because we are not going to produce the same results everywhere. Can we? We can't. Every person comes to us, can we do the same results? We do the perforations, we seal it. But we can't save every patient. Right? So, science has laws. Like statement of truth based on repeated experimental observation that describes some universal attributes to the nature. This is what science is. There is one repeated experimental observation. Same thing. Fine? So, what is that? Laws are rules that nature must live by. Yes or no? The law is different. Our rules are made to make our life easier. Protocols are makes our life easier. What we read, what are the things, what you say, all the things yesterday he was asking about a score and all these things. These are made to make our life simpler, to make our approach simpler. But these are not laws. We don't have to stick to them. Fine. We don't have to be biased with them. Because the studies, the things which has been made in a different place, it may not be applicable to our patients. So I should understand where I am working, who are my patients, what are their behaviors, what are their food habits, what are their mental status. Everything is different. A European study cannot be matched in an Indian study, Indian population. Okay, we have to follow. Okay, this happens. Okay, we have to understand. We have to have the knowledge. We have to go by that. But it should not be a thing that this is the thing which has to happen like this. I always say, laws protect us from unknown danger. Laws are like lighthouse. I always get. So lighthouse, do you think lighthouse ever moved? Lighthouse is a place where it stands forever. The ships lighthouse are made for the direction of the ship, no? Ship has to move their direction according to the instruction from the lighthouse. The lighthouse never changes, but the ship has to, or whoever has to follow, they have to follow the rules and regulation for that. Fine. So laws are like, they are to protect us, and they are just like lighthouse. Law had to distill some universal grinding principles of medicine into a statement of truth. So now I've come to the 3 laws. Those things will have, if we call it law, then it must be having some values, something which will be repeated. So what are those things? This Dr. Siddhartha Mukherjee, after doing a lot of studies, he has made these few things, and I like those things. And many of the people out of the world are following those. Not following, they understood these laws. So, laws of medicine cannot be described through equations, constants, or numbers. But we are now playing with these equations, constant, and numbers in our words. So, we have to understand what are the laws, then we can play with them. We can have them, but we have to understand them. So William Osler, what he told, this is a very important word, medicine is a science of uncertainty and an art of probability. What is probability? What is a probability? Chances. Suppose I tell you, I have a coin, I'll throw it up and I'll say head or tail. How can you say that? It will be head or tail. What is the probability of head and what is the probability of tail? 50%. Now, in a place, suppose you saw me doing that thing, let us experiment it. We have done it 100 times. And you found that in this coin, its head is 70 times it is falling head and 30 times it is falling down. Now, with that knowledge, I go to you and I'll tell you, now tell me, what is the thing, what you will say? No, you will say head or tail? You will tell head. Why you have told head there? Now you are not other. Because I know that chances are there that this is mostly wrong. Because I have seen them wrong for so many times. So I don't believe. My probability, in my mind, the probability that the reports का कोई मतलब नहीं है. Just see and give them antibiotics. Many of the drugs came to the market, like when we were practicing 2000, the peptides came to the market. In 2000, I think it was 99 or 2000, peptides came to the market with 5 milligram tablets. And it was a hot discussion. This is the first drug which is reducing edema and all these things. And I started giving 5 mg. But after some time, I didn't find any results. I gave 10 mg by myself. I experimented. Now I found little bit of that was a difference. And when the summer came, then there was zero result again. I called that company person and I asked him, what क्या medicine है तुमने वो दे दो 5 मिनट तो काम ही करता है and it's working 10, I have to give 10 milligram and when the heat is there and it is look into things what is happening क्या heat level है it is with temperature it is not unstable to heat. I didn't know, I never had, but I have observed these things. And after 1 year or 2000 or 2 or 3, all the reports started coming. Or this is the only highly unstable in summer. Then they came up with the 10 milligram, 15 milligram tablets. Peptides came into the market. I am not a researcher. I am not a drug person. But I have observed. I have seen the probability. I played the game of probability there. It's not working here. Probably this job is not working. This is what probability is. Here you have to find out with your patient, with your environment, you have to think what is the best thing I can give to the patient. Here if we think, we have seen that 10% of mine has got through this, results are good, then for me this is the best treatment I can give to my patient. Whoever is telling anyone in the world, I don't bother. मेरे को bother ऐसा नहीं है मेरे patient का result अच्छा मिलता है 30 years now down the line all of my patients which I do send the same procedures and I get it. But I never followed any principles of anybody who was told. Maybe it is working for them. Maybe their situation is different. One shot antibiotics came into the picture. Single shot antibiotics. It came and 7. But our hospitals were not dead. That came from European studies. That their cleanliness, our cleanliness were not changed. Now in this hospital, when we have a hospital like this, we can use that one. But that time we were not able to use that one. It's because we have found that what is matching to our thing. The first law. A strong intuition is much more powerful than a weak test. How many of you agree with that? What do you mean by that? A strong intuition is much more powerful than a weaker test. I'll give you an example. Everybody, my surgical resident, they see every day. When a patient enters with a pain abdomen, fine, with all the reports normal, and the patient start talking to us, we know, I always understand that this patient is having something, otherwise he would not have come to me. And I put my hand, I put in the right leg fossa, I get mild tenderness, I tell you that appendicitis hai. So my CT scan report normal hai, mera wo normal hai, and the patient is moving for last 6 months. But my intuition tells that it is appendicitis. Now it's my duty to convince the patient for this thing, because it's very difficult now. Every report comes normal, then how can you say it is appendicitis? But there, my intuition is more stronger, because no test, I know it very well, no test will pick up the appendix. Nothing will pick up the appendix. I also know that. But who will tell these people? If we go by the reports, we go by the test, this patient will go on suffering. And we operate that patient. And I have cured more than thousands of people from this particular side of thing. One example that I'm telling you. So tests come with, again, results with probability. How, like many of the reports in our hospitals, in lab reports, many of the lab reports we don't believe. Because lab is a machine, these are machines. It depends on the operator. Depend on how careful they are operating the machine. How they are feeding the machine. Machine report they come, whatever you are going to give it. It doesn't by itself tell. So it is up to that. So there may be some problem out there which is causing the report may be wrong. So if your report doesn't match to the patient's complaint, we may not be agree with that report. So if you play with the numbers only, then you are going to lose your patients. But if you understand that my intuition, if I feel this is, you have to have a calculation of your own. If they're looking at the patient. So gradually when you grow, when you start doing the things, you will see more and more patients, you will develop this intuition. And you will be there, report, always all report has been said, kindly correlate clinically. That is the reason why it is written like this. Reports never say. But if we based on this thing, we will be failing in many places. So there are certain examples I'll give you. So I told you about the prior knowledge helps us in the more cases you see, the prior knowledge, your probability and your patient diagnosis are more better. Okay. Now let's go to the next. Now second law, normal teaches us the rules, outliers teaches us laws. What is meaning by this thing? What is normal and what is outliers? Outliers किसको बोलते हैं? Anybody any idea? Outliers एक बहुत एक किताब भी है ना, there is a book called Outliers. उसका पर outliers को there are people, outliers mean who stood different, who look at the, suppose like I tell you, there is a chemotherapy drug in 70s or 80s, one chemotherapy drug was, it looks very promising. And it was, they started giving, this drug was, this will be curing a lot of cancer patients. And they started, first phase of experimentation, results were very good. Fine. But during the second phase, third phase, fourth phase, the reports were not at all very much promising. But in that patient, one of the patient out of second phase, third phase did very well, and his total remission was there. Total remission. Now, everybody was thinking about, they were about to discard that particular, that drug. But one of the junior scientists out there, he noticed this person is having a spontaneous remission, and he was looking at this one person. He was not looking at the 99% of people who failed. He was looking at this one person, and he started studying that person. He did a genetic sequencing. Fine. And he found out there are certain genes were mutated for 140 times in particular case. And those mutated genes, those was the protecting this person. So now they thought that these genes, if the person is having a T, E, and something name is there, if it is there, and this person may respond very nicely to the drug. And they found out many other people who think the same. They now started doing the thing with those having this particular gene, this drug, and it worked with everyone. Now, this one person, or the scientist, junior scientist, he was working on outliers. He was not thinking like the normal. He was not thinking like normal. He was thinking like he was looking at the thing who was not working. So these are called outliers. Fine. But the normal teachers, normal patient, what we are every day, what we patients we see and we're doing, their normal patient, that follow the rules. They are, if you follow the rules, they will be treated. But the outliers जो होते हैं हमें टीच करते हैं. कोई पेशेंट ऐसा होते हैं ना जिससे हम लोग बहुत कुछ सीखते हैं. And if we say कि हाँ हो गया चलो ठीक हो गया चला गया, then we may not learn anything from them. The response from that patient, why that patient has improved, what has happened, what difference, what made the difference. Like I tell you, after I found the difference between this healing process, that why some patient was healing faster and one in my 2005 at the time when I was seeing a lot of patients. Every day I used to operate around 8 to 10 cases, 15 cases a day. So I was studying with those type of things. Why this is happening? Why this? So I noticed one thing. The patient with a growth mindset, but there were the people who were expecting, and whose expectation for me was very great. They have a lot of faith. Their wound was healing very faster. And the people who were not, they were doubt or they were something, they have come by just chance, their healing was slower. Because I studied these people, why these people are healing faster. So these are some outliers has taught me that no, I have to. So then I developed a habit of connecting with them. So every patient who comes to me, they are connected to me. I think within seconds I can connect with them. By some way, I have learned techniques to connect with them. Fine. And once you connect with them, they develop faith on you. And bas, tomorrow healing will be always better. The wound, people come with 3 months, 4 months wound, non-healing wounds, and they get good result from us. It's because of that particular thing. Something you have to understand. What is making this my patient better? If one patient is getting better, what is that? Let me see what difference I have made to this person. And there you will identify an outlier, and you may make your own rule. So in medicine, these laws, or whatever laws has been made, is because of this. There are a lot of examples given in this book where they have identified one person which is not working or which is worked, and they followed the rules. But for normal people, this probability game is enough. And the third law is very good, it's a very elaborate one, and I'll give you only one example of that. For every medical experiment, there is a perfect human bias. If everybody should agree with that, today in today's world, if you are in modern medicine, every conferences you go, everywhere you meet people with all big things, big banners, fine, they bias you, some extent. They bias you. And with that bias, what happened? You start following them without understanding whether they are doing the right thing or the wrong thing. One of the biggest example is the William Halsted. William Halsted, if you know anybody, William Halsted mastectomy and a lot of surgical procedure there. He was one of the biggest surgeon. Halsted बोलने से लोग Halsted, बस वो जो किया वो भगवान है. वो भगवान जो होता है ना, वो हमें misguide करते हैं. There is nobody Bhagwan here. He might have done something with his own patient, his own things. It's okay. But for me, the people are different. And he did radical mastectomy for 100 years. We followed radical mastectomy with a thing that it is going to cure breast cancer. 100 years, nobody asked a single question. But suddenly, one person came out. He told, why should we do the things? It's happening. It's the thing. Again, if you do a radical mastectomy, also there is metastasis and the patient dying of this. Let us do something different. Let us do a lumpectomy. And with that combination therapy, he started showing the same results as this. Then why to remove a breast of a patient? We never asked Wilson why Wilson Halsted was doing this much of surgeries for 100 years, 100 of ladies that were being breast have been removed without any reason. So this is what is happening in every field. If you talk about diabetic trial, you talk about the thing, diabetic medicine comes, then some people tried exploring the obesity. Now, it's working the obesity. Okay, let us try the obesity. See, all this is happening. But you have to now here as a doctor, as a physician, you have your own mind and your book, you have your own knowledge bank with yourself and your logical mind. There you can always compare whether if I'm doing this, is it the right thing? And book, I think till now, every book has the things which have been given in the book, it is still in we have to believe that. Many of the things which have been discussed in the seminar, in the conference, this still has to come. But once a week, I call them, in a modern medical school, we have been taught about the anatomy, physiology, biochemistry in the first year. They are the basics about it, but we have forgotten that one. And we have never given stress on them. If we go to that, we will be able to analyze why my patients are not healing. If I looked into them, I found out that it is because somewhere in the cellular level, there's something is happening. I have to understand cellular. I never understood the cellular pathways. And then one patient we have, if you remember that vagotomy, the patient was not responding for so many days. We have started giving them energy, lipid and all these things. And 3 days he went because nobody was understanding what our cells want. So basically, if we have to move, become a good doctor or to become one step ahead, we have to understand all the diseases and health in the cellular basis because everything starts with the cell. If you understand their movement, the way they are behaving, we can solve many of the problems by ourselves only. Right? This is what my center is, and this is what I'm working now on the cellular protocol. Cellular means revival at the cellular level. How can it be? So I'm coming up with a lot of protocols for hypertension, diabetes, cancer, anxiety, all the things. So I'm preparing a protocol through which we want to teach people. We are going to the people to take care of themselves by certain protocol. But they have to take the medicine as per the advice of doctors, not it is a complementary to the modern medicine. Thank you very much.